Understanding preeclampsia, a pregnancy complication. Pregnancy is a time of immense joy and anticipation, but it can also come with challenges. One such challenge is preeclampsia, a condition that affects some expectant mothers. Understanding preeclampsia is crucial for early detection and management. Preeclampsia is a pregnancy-specific condition characterized by high blood pressure and protein in the urine. It typically develops after 20 weeks of pregnancy, often in the third trimester. Preeclampsia can range in severity from mild to severe, and in some cases, it can lead to serious complications for both mother and baby. While the exact causes of preeclampsia are not fully understood, it is believed to be related to abnormal development and function of the placenta. The placenta is a vital organ that connects the developing baby to the mother's blood supply, providing oxygen and nutrients. When the placenta doesn't function properly, it can trigger a cascade of events leading to preeclampsia. It's important to remember that preeclampsia is a serious condition, but with proper medical care and monitoring, most women with preeclampsia go on to have healthy pregnancies and babies. Recognizing the warning signs, symptoms of preeclampsia. Recognizing early signs is crucial for prompt medical attention. High blood pressure is a hallmark symptom. Another key symptom is proteinuria, or protein in the urine. Other symptoms include severe headaches, vision changes, and swelling. Contact your healthcare provider immediately if you experience these symptoms. Potential risks. Impact on mother and baby. Preeclampsia can have significant implications for both the mother and the developing baby if left untreated. It's important to understand these potential risks to emphasize the seriousness of this condition. For the mother, preeclampsia can lead to complications such as eclampsia, a life-threatening condition characterized by seizures. It can also cause HELLP syndrome, a severe form of preeclampsia that affects the liver and blood clotting. Other risks include placental abruption, where the placenta detaches from the uterine wall, and stroke. Preeclampsia can also impact the baby's growth and development. Because preeclampsia affects the placenta, it can restrict blood flow to the baby, leading to fetal growth restriction. This can result in low birth weight or premature birth. Premature babies are at increased risk for breathing problems, feeding difficulties, and other health issues. In severe cases, preeclampsia can be life-threatening for both mother and baby. However, with early detection and appropriate management, the risks can be significantly reduced. Diagnosing preeclampsia, blood pressure, and beyond. Diagnosing preeclampsia involves a combination of monitoring blood pressure, urine tests, and assessing other symptoms. Regular prenatal checkups are essential for early detection. During your prenatal appointments, your healthcare provider will regularly check your blood pressure. A significant increase in blood pressure, or a reading of 140/90 millimeters of mercury or higher on two separate occasions, at least 4 hours apart, may indicate preeclampsia. In addition to blood pressure monitoring, your healthcare provider will also test your urine for proteinuria. This is typically done using a urine dipstick test, which can detect the presence of protein in your urine. If preeclampsia is suspected, further tests may be recommended. These may include blood tests to assess liver and kidney function, as well as to check platelet count. Ultrasound scans may be performed to monitor the baby's growth and assess the health of the placenta. And Section 5. Managing preeclampsia, treatment options, and considerations. The primary goal of managing preeclampsia is to prevent complications and ensure the safest possible outcome for both mother and baby. Treatment options vary depending on the severity of the condition and how far along you are in your pregnancy. For mild preeclampsia, your healthcare provider may recommend close monitoring of your blood pressure and urine protein levels. You may also be advised to rest, increase your fluid intake, and make dietary changes, such as reducing salt intake. In cases of severe preeclampsia or when the baby is nearing full term, delivery may be recommended. This is because delivery of the placenta is the only definitive cure for preeclampsia. If delivery is not yet advisable, your healthcare provider may recommend medications to lower blood pressure and prevent seizures. Corticosteroids may also be given to help mature the baby's lungs if premature delivery is a concern. Section 6. Prevention and early detection. Empowering expectant mothers. While there is no guaranteed way to prevent preeclampsia, there are steps expectant mothers can take to promote a healthy pregnancy and reduce their risk. Maintaining a healthy lifestyle during pregnancy is crucial. This includes eating a balanced diet, getting regular exercise, and managing stress levels. Attending all your prenatal appointments is essential for early detection of any potential problems, including preeclampsia. During these appointments, your healthcare provider will monitor your blood pressure, check your urine for protein, and assess your overall health. If you have any pre-existing health conditions, such as high blood pressure, diabetes, or autoimmune disorders, it's important to discuss these with your healthcare provider. They can advise you on how to manage these conditions during pregnancy and minimize any potential risks. Section 7. The importance of prenatal care. Your partner in a healthy pregnancy. Prenatal care plays a vital role in the early detection and management of preeclampsia, as well as other pregnancy complications. It's essential to establish care with a healthcare provider as soon as you suspect you're pregnant and attend all scheduled appointments. Regular prenatal checkups provide an opportunity for your healthcare provider to monitor your blood pressure, check for protein in your urine, assess your overall health, and address any concerns you may have. During these visits, don't hesitate to ask questions, share any symptoms you're experiencing, and discuss any anxieties you may have about your pregnancy. Open communication with your healthcare provider is key to ensuring a healthy pregnancy. Remember that prenatal care is not just about monitoring your physical health, but also about providing education, support, and guidance throughout your pregnancy journey. Section 8. Preeclampsia, understanding the underlying causes. While the exact causes of preeclampsia are still being researched, experts believe it's a complex condition involving a combination of factors. These factors can include genetics, immune system dysfunction, and underlying health conditions. Genetics plays a role in preeclampsia, as women with a family history of the condition are at increased risk. If your mother or sister experienced preeclampsia, it's important to inform your healthcare provider. The immune system is thought to be involved in preeclampsia, as the condition is believed to be triggered by an abnormal immune response to the pregnancy. This immune response can affect the development and function of the placenta. Underlying health conditions, such as high blood pressure, diabetes, and autoimmune disorders, can also increase the risk of developing preeclampsia. Section 9. Long-term implications, health considerations after preeclampsia. Most women who experience preeclampsia go on to have healthy pregnancies in the future. However, having preeclampsia can increase the risk of certain health problems later in life. Women who have had preeclampsia may be at a higher risk for cardiovascular disease, including heart disease and stroke. This risk is particularly elevated for women who develop preeclampsia before 34 weeks of pregnancy or who experience recurrent preeclampsia. Preeclampsia can also increase the risk of developing kidney disease later in life. This is because preeclampsia can damage the kidneys, making them less efficient at filtering waste products from the blood. It's important for women who have had preeclampsia to maintain regular checkups with their healthcare provider and adopt a heart-healthy lifestyle to minimize these risks. Section 10. Support and resources, navigating preeclampsia together. Navigating preeclampsia can be emotionally challenging, but it's important to remember that you're not alone. There are support groups, online communities, and healthcare professionals who can provide guidance and reassurance. Talking to other women who have experienced preeclampsia can be incredibly helpful. Sharing experiences, coping strategies, and emotional support can make a significant difference. Your healthcare provider can also connect you with resources and specialists, such as perinatologists, who specialize in high-risk pregnancies, and dietitians, who can provide guidance on healthy eating during pregnancy. Section 11. Empowering your pregnancy journey. Knowledge is key. Pregnancy is a transformative journey filled with anticipation, joy, and sometimes challenges. By understanding preeclampsia, recognizing the warning signs, and knowing when to seek medical attention, you can approach your pregnancy with greater confidence and peace of mind. Remember that regular prenatal care is your greatest ally in ensuring a healthy pregnancy. Don't hesitate to ask your healthcare provider questions, share any concerns, and advocate for your well-being. By staying informed, making healthy choices, and working closely with your healthcare provider, you can empower yourself to have the best possible pregnancy experience.